Chapter 5, Safety and First Aid. This chapter is going to go over an overview of safety and first aid, including some items we utilize in the classroom in case of safety and first aid concerns, and also in the hospital setting. We want to know the locations of fire extinguishers and fire blankets. We want to participate in safety education programs to become skillful on the use of fire safety equipment. Most hospitals yearly will have you take some type of safety test. Be familiar with the use and location of fire extinguishers and procedures to follow during a fire. This is just an image of a fire hose with a fire extinguisher. It's normally behind a locked cabinet. In the hospital setting, a lot of times these locked cabinets are a direct link to the fire department, so as soon as they're open and something's taken out, it alerts the fire department as well as using a fire alarm. There's 3 different classifications of fires. Class A is generally requires an ABC extinguisher, a pressurized water extinguisher. Example Class A fires would be wood, paper, cloth, and trash. Class B fires require ABC extinguisher or carbon dioxide CO2 extinguisher for liquids, grease, and chemical fires. And Class C fires are electrical fires, and CO2 halon or ABC extinguishers can be used. Generally, in a household setting, the ABC extinguisher is used because we don't know what types of fires we're going to come up against. So it's better to have a universal that will fight any of these. Please be aware that certain fire extinguishers, as shown here, like the CO2, cannot be used on Class A fires. And the halon fire extinguisher can't be used on Class A or Class B. Emergency response to possible fires. This video is just, it's a episode from Seinfeld. What not to do in case of a fire. Things not to do. We don't want to block entrances, re-enter the building, panic, or run. In the hospital setting, in addition to, we don't want to, it depends where the fire is located. If it's on a separate floor from our patients, they'll instruct us to close the doors to the patients' rooms, and the fire doors will close at the entrance and exits of our unit. The other thing to keep in mind too is we don't want to enter elevators because elevators shut down during fire safety concerns because we don't want people trapped in an elevator or between floors. So electrical safety, major hazard in any area of the healthcare institute is the possibility of electrical current passing through a person. The healthcare worker should be aware of the location of the circuit breaker boxes in order to assure a fast response in the event of electrical fire or electrical shock. Using electrical equipment, you do not want to use frayed power cords. Do not use worn control switches and thermostats. Know where the closest fire extinguisher is located and avoid handling electrical equipment and instruments when standing on wet floor or having wet hands. Being aware of this equipment and taking it out of service is the goal. The other thing too is that we never want to try to pull a plug on electrical equipment if someone is standing in water, because then we could potentially get electrocuted as well. That is why it's essential to find the electrical box. If the equipment has a label with electrical caution warning, do not open it. While collecting blood, avoid contact with electrical equipment. Use a 3-prong hospital-grade electrical plug and no actions to take an electrical accident. The 3-prong plug allows for a ground here. There's also 2 different types of outlets in the hospital setting. There is the white outlets, which is general use outlets, and then there's red outlets. The red outlets are utilized for life-saving devices such as ventilators, incubators. Those are directly attached to our backup generators in case of power failure. Radiation, there is a 3 cardinal principle of self-protection. It's time, shielding, and distance. Time is the amount of time the patient's exposed, so they generally try to make it a minimal amount of time. Shielding, they provide a kind of lead-proof protective shielding that will go over key components of our body, and distance. Radiation, X-ray, CT, MRI are generally located in a closed-off section of the hospital where there isn't regular foot traffic. So it's being aware of this. Distancing also for the employees. They will go behind a glass shield, and minimizing exposure. So time, distance, and shielding is a three-cardinal principle of self-protection. The other thing to be mindful of in shielding is that although not recommended, pregnant patients shouldn't get x-rays, but if need to, they will use a kind of triple shield on them to protect the fetus as well. Areas where radioactive materials are in use and stored must have a warning sign, which looks like this. Nuclear medicine, X-ray department, research, or clinical laboratory. In addition, we might see this sign on a yellow, what looks like a sharps container, but it lets us know that radioactive material is present inside in cases where patients receiving chemotherapy. Areas where radioactive materials are in use and stored must have warning signs. They limit the time of exposure to patients with radioactive implants. A dosimeter badge should be worn in these areas, and I'm going to kind of zoom in here. Dosimeter badge looks like this. It's a badge with the technician's name on it, and it kind of measures the amount of radiation that the patient is exposed to. Or the technician, I'm sorry, is exposed to, because in levels of high radiation, they might decide to change their shifts or schedules. Healthcare workers who are pregnant should be aware of the potential hazards of radiation to the fetus as well, and again, their use of protective equipment. Mechanical safety, so we want to use correct carriers and positions. If the carriers are not in the correct position, they can swing out of the holding disc into the side of the centrifuge. Tubes containing patient specimens or spinning chemicals may be propelled into the side of the centrifuge, break, and create hazardous problems. And even if precarious events occur without dangerous consequence, imbalanced tubes can cause falsely elevated or decreased laboratory test results. Generally, in a centrifuge, we're going to balance things across from each other. We will have a detailed lab and video to show you how to balance a centrifuge. The other thing to be mindful of with the centrifuge is it spins at about 6,200 RPM, so it spins a very high rate of speed, and we do not recommend opening a centrifuge until it is fully stopped spinning when you want to add specimens inside. It does have a locking feature that will prevent you from opening it. Chemical safety. Pouring preservatives. Examples of a preservative would be hydrochloric acid. Mixing chemicals, bleach with any other cleaning agent can lead to a dangerous gas. So be mindful, making sure chemicals, we have labels present on them. We know the hazards involved. And also too, when we're pouring it, we're doing it behind a safety shield. And when mixing chemicals, we're being mindful on the warning labels, not to mix them with things that like this. If you mix bleach with other things, it could cause gases. Labeling is the single most important step in proper handling of chemicals. The laboratory workers should be able to ascertain from appropriate labels not only the contents in the container, but also the nature and extent of hazards posed by the chemicals. So that way we can utilize the SDS and MSDS safety data sheets to find out how we can handle these chemicals. And if we had to call poison control, we can tell them the exact chemical we were exposed to. This is just some of the various labels we might see: flammable, explosive, radioactive, harmful if swallowed. It will firing because it has oxygen inside. So just being aware of some of the different warning labels we might see. Chemotherapy chemical exposure. So healthcare workers involved in blood collection in patients with cancer may become exposed to chemotherapy. Exposure to chemotherapy requires the usual PPE, so it's going to be gloves, gown. Chemotherapy spills require healthcare workers to leave the area, and there is a special kit that's used to clean up that spill. Chemical identification. The right to know law requires chemical manufacturers to supply what's called a safety data sheet for their chemicals, which tells us both the chemical makeup, any health fire potential hazards as well. The GHS Global Harmonization System requires the use of the SCS format. So in our lab, every chemical is going to have a sheet that we can reference. The NFPA labeling system for hazardous chemicals, the National Fire Protection Association system, uses a diamond-shaped symbol. It's 4 color quadrants and hazard rating of 0 to 4, which we will look at here. Okay, so on this, 2, our blue quadrant, is going to be associated to our health hazard, and a 2 would mean this is hazardous. So 0 normally means, not hazardous, will not burn, stable, where 4 could be deadly, may detonate, gases and liquids. Our red quadrant is going to be the fire hazard. This one says pertaining to readily burn. Yellow quadrant's instability of 4 may detonate, and white would be our specific hazard. And each quadrant will have a number, or in this case, is it an oxidizer or water reactive? So I gave an example of bleach, the chemical identification. So red, blue, and yellow quadrants will contain a number from 0 to 4. 4 indicates a high degree of hazard, 0 indicates a low degree. So in this, it's not an oxidizer, it's not water reactive. Our health quadrant being a 2 means bleach is hazardous. 0 means that bleach will not burn. And our yellow quadrant being a 1, if we go back to our chart, means that it's unstable if heated. So this is how we would read it. Also, too, in chemical identification, it's going to list its chemical name as well as its common name, so sodium hypochlorite, also referred to as bleach. Chemical measures. So personal protective equipment, PPE, and clothing must be worn when the healthcare worker is working with chemicals. And when transporting acids and alkalines, an acid carrier should be used, and it is recommended. Protection for measures for chemical use. The entrance of a room in which hazard chemicals are in use or in storage must be posted with a caution sign, as shown here, specifying the types of chemicals present, and then there's another sign here. Just being aware of the fact that when we have hazardous chemicals, we don't want to store our flammables next to our oxygen tanks, obviously. So there is a specific regulated area we store chemicals. Protective measures for chemical use. No chemical should be stored above eye level because of the danger of breakage or spillage involved in reaching for them, and no chemical should be stored in an unlabeled container. So I'm going to give you 2 examples of this. We don't ever want to store a container above eye level or try to get a container down using, let's say, a broomstick, because if the container were not to be sealed properly, it could spill on you. No chemical should be stored unlabeled. In our lab, we generally use saline bottles, the medical technologists, to clean slides. We don't know what type of chemical was in the container. It wasn't saline, but it started to burn through the slide and it burned the technician's hands. And in that case, when we went to the SCS safety data sheet without knowing what the chemical was, we didn't know how to properly treat it, which then becomes a huge risk factor for everyone involved. And it makes it very hard to determine what would be efficient to help that particular technician. So no chemicals should be unlabeled. They shouldn't be stored above eye level. And we also want to make sure, too, that we're sealing containers after use. No chemical should be poured into used containers or dirty containers, and all explosives should be stored in an explosive-proof or fire-proof room that is separate from flammables. Chemical safety. So safety showers and eye wash stations. Victims of chemical accident must immediately rinse for at least 15 minutes after removing contaminated clothing. In case of chemical spill in the eye, the victim would rinse his or her eyes at an eye wash station for a minimum of 15 minutes. We have 2 eye wash stations in our lab, both located at sinks. Contact lenses must be removed prior to rinsing in order to thoroughly cleanse the eyes. The other thing too is we'll instruct the person to prop their eyelids open, because our first reaction when anything touches our eyes is to close them, so we have to kind of forcefully prop them open. And we will follow up with ER care after. Chemical spill cleanup kit. First, make certain no one is injured. Call emergency number if this is the case. And if everyone is okay, immediately obtain the spill cleanup kit with clinical chemistry section and contact the appropriate safety department for assistance. In our lab, we generally use a bloodborne pathogen cleanup kit because as phlebotomists, we're more in contact with blood. We would use this spill cleanup kit if a large amount of blood were present. So we're talking like anything bigger than like a small pool. Chemical spill cleanup. Absorbent neutralizers are used depending on the type of chemical spill, and an indicator system identifies when the spill has been neutralized and can be considered safe. So generally it is either a blue chemical that changes to white or a white chemical that changes to blue that lets us know that it's been neutralized and we can then sweep and clean it up. Equipment and safety in the patient's room. They provide patient privacy, make certain all specimen collection supplies, needles, and equipment are properly disposed of or returned to the specimen tray after blood collection, and check on the position of the bed rails. If the bed rails were up upon entry into the room, we need to make sure the bed rails are up upon leaving. Make sure the patient has everything they need, call light. And the other thing too is we want to make sure to account for all our supplies. So tourniquet, needle, test tubes, any equipment. We don't want to leave anything in the patient's bed. Patient safety related to latex products. So symptoms of an allergic reaction to latex would include skin rash, hives, facial swelling, nasal, eye, or sinus irritation, sometimes shock. Please see table 5.2 in your textbook. Products that contain latex that we utilize is tourniquets, bandages, and in some circumstances are gloves. So we just want to check with the facility we are working with to determine what products contain latex, and also be aware if a patient has a sign about a safety concern with latex. Disaster emergency plan. Healthcare institutions must be disaster ready in case of hurricane, flood, earthquake, bomb threat, and other disasters. Healthcare workers should be familiar with the disaster preparedness plan, and generally there's a plan next to the phone. We also have one on campus at Harper next to our phone. The other thing too is that they have a kind of code system. So like in a hospital setting, a code blue would be a patient in respiratory distress. A code red would be a fire. So they have certain things to be able to tell the hospital wide what's going on. Emergency procedures, so bleeding aid. Severe bleeding from an open wound can be controlled by applying pressure directly over the wound. Use standard precautions from exposure to blood and other potentially infectious materials, so wearing gloves, having gauze nearby. So you're going to use PPE, gloves, and mask. A clean handkerchief or other clean cloth compress should be placed over the wound before applying pressure by the gloved hand. An emergency in which a clean cloth is not available, the gloved hand should be used using a cloth compress. Can be unlocated, and bleeding of the limb can be decreased by elevation, but we want to make sure the patient doesn't have any broken bones prior to doing this. The other thing to be aware of is that raising it above the patient's heart will help slow down the bleeding. Okay, shock prevention. Reasons for shock include severe injury, bleeding, excessive burns, insufficient oxygen supply, and other traumatic events. So early signs and late signs of shock. Early signs of shock include pale, cold, clammy skin, weakness, rapid pulse, increased shallow breathing rate, and frequent nausea and vomiting. Late signs would include this, so just being aware of that. Patients that experience shock would be due to a traumatic event or a large amount of blood loss. If you've ever had an injury or car accident, you might have experienced shock. I myself had an experience with shock when I was at work and I dislocated my kneecap, and that caused me to go into shock. Your blood pressure kind of goes down, your heart rate goes up, you might be pale, might be cool and moist and anxious, and your respiratory rate goes up initially in the depth. Eventually, your body tries to compensate to preserve itself, and these late signs of shock would go into play. Shock prevention. So actions not recommended include giving fluids to a victim who has abdominal injury, person is likely to require surgery or general anesthetics, and giving fluids to unconscious or semi-conscious person. The one thing that I want you to be aware of in Chapter 5 as we summarize is going over the classes of fire. The other thing that was not included in this PowerPoint that I want you to review is the acronyms RACE and PASS. PASS is the acronym we use to operate a fire extinguisher. P is pull the pin. A is aim. We're going to aim at the base of the fire. Squeeze the handle and sweep side to side. And RACE is how we're going to respond in case of an emergency. So rescue, alert, confine, and extinguish as necessary. I will make sure to provide an image of both along with this PowerPoint, but please review RACE and PASS as well in your reading of this chapter. Make sure to review and read Chapter 5, go over the questions at the end of Chapter 5, and view any videos that are posted along with this PowerPoint. The other thing to be aware of when it comes to safety is that we are responsible not only for ourselves, our coworkers, but also for our patients, making sure that they have a safer environment. So an environment that doesn't include clutter in the hallway where patients could potentially trip or fall, being aware of spills in the patient's room, so if they need to be cleaned up right away, or clutter. So just keeping that in mind as we go into the healthcare setting. That concludes Chapter 5 on fire and safety.